Speech disorders have frequently been the punchline in pop culture. Who here hasn't heard someone do an imitation of Donald Duck or Elmer Fudd and had a big laugh about it? Well, for the 7.5 million Americans who have issues using their voices, it may not be so funny. In young children, the prevalence for speech impairments is around 9%, with about 5% of students in first grade having some noticeable speech disorder. In addition, 6 to 8 million Americans have some form of language disorder. Roughly 18.5% of students receiving special education services are receiving them for a speech or language impairment. The legal definition of speech and language impairments taken from the IDEA Act of 2004 is: speech or language impairment means a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. Speech is the expression of language via sounds. A speech impairment can manifest in several different ways, such as an individual having problems with correctly generating speech sounds, having trouble articulating correctly, or stuttering. Language impairments refer to a range of disabilities resulting in an individual having difficulty expressing ideas, understanding the form of language, or understanding and retaining details expressed to them. It is important to note that these issues in understanding do not necessarily come from difficulties hearing. Two main ways to look at speech and language impairments is expressive and receptive. Children with expressive impairments have trouble with grammar and in formulating questions or expressing their thoughts. With receptive impairments, children have trouble following directions, understanding figurative language, and responding to questions. Speech disorders include articulation problems where speech sounds are not produced correctly, fluency disorders like stuttering, and voice disorders which affect vocal quality. Language disorders include deficits in organizing speech patterns, apraxia of speech, grammar and syntax deficits, semantic disorders, and problems with language in social contexts. Common difficulties that are present due to speech and language disorders include students preferring not to speak in class, difficulties understanding teacher instruction, and difficulties with oral class assignments. It is important to remember that language and speech impairments are not necessarily intellectual disorders. In the case of speech disorders, a lack of muscle control or coordination can be at the root of the condition. Some warning signs for potential speech or language disorders include a limited vocabulary, issues with grammar, trouble following directions, poor reading comprehension, difficulties responding to questions, and long pauses in speech. Assessment includes a formal measurement of the individual's speech and language capabilities, as well as collecting information on their case history like age, gender, cultural background, and family situation. Some teaching strategies that may help students with speech and language impairments include using visual cues. These may be beneficial for students with language disorders as they give a clear message and reinforce the language of the intended instruction. Using gestures may help students to understand the message of the instruction. Strategy 2. Clear, precise instruction gives students less opportunity to be confused by the language. Giving simple instructions in a sequence can alleviate confusion. Giving instruction with noticeable inflection, such as when asking a question, can also help the student. Strategy 3. Having a planned seating arrangement can cut down on potential distractions for students that must focus harder to understand the lesson. Seating them away from windows or doors and closer to the instructor may improve their ability to focus. Strategy 4. The instructor should make sure they have the student's attention before giving directions. If a student misses a portion of the instruction, they may fall behind in class. Strategy 5. If possible, the instructor should pre-teach topics to students with speech and language impairments so that when they learn it with the rest of the class, they will be hearing it for the second time, which should help reinforce the information. A teacher should not call attention to non-fluent speech or allow others to do so. Saying things like stop and start over, cat got your tongue, and just spit it out would be inappropriate and not helpful to the student. It could add unnecessary anxiety about speaking up in class. Augmentative and Alternative Communication, AAC, is the technology used to assist these children. Teachers should be aware of assistive technologies that are available for individuals with severe speech disorders, such as low-tech picture symbols to generate speech, as well as high-tech speech generators. Collaboration is an important tool to help a student succeed. The general education teacher should work with the student's speech and language pathologist to implement strategies in the classroom that have proved successful for the student in therapy. In order to maximize a child's chances for success, early intervention and an accurate diagnosis are key, as well as providing well-designed, research-based interventions.